Hi, we're here with Kristy Greenwalt, who is Director of the Washington, D.C. Interagency Council on Homelessness. We're here in Washington, D.C., our nation's capital, site of the inventions of a lot of things, including go-go music and the half smoke, and blood banks were invented here. But Kristy's working on some very innovative programs. So Kristy, you coordinate all the work of the different agencies working on the homelessness issue in Washington, D.C. The coronavirus as a pandemic really has made everyone in the country and everyone in Washington, D.C. feel very vulnerable. Some of what were considered the strongest businesses are in danger of closing. People are losing their work. People are in danger of losing their housing. You work with the most vulnerable population amongst us. What is it like to work with the most vulnerable when everyone seems to feel vulnerable right now?
It's a really good question. I mean, I think working in this space is always challenging because there's such an extreme scarcity of resources to help so many people that need assistance on any given day pre-pandemic. But the COVID-19 has certainly made our work more difficult. And I'm stating the obvious, but all of the guidance to everyone across the country and really around the world has been stay at home, isolate, minimize your contact with others. And when you're homeless, you can't do that. And so you're faced with this choice of, do I sleep on the street where I might be a little more isolated, but then I don't have access to food and running water and other basic necessities? Or do I go into a crowded shelter where I'm going to be crossing paths daily with dozens and sometimes hundreds of other people, sleeping in close quarters? A lot of our large congregate shelters are bunk beds. People are sharing bathrooms. And so we were really terrified in the beginning that we were going to see just a mass outbreak across our shelter system. And I will also say, one thing that's really weighed heavily on me is that our single adult population is an aging one. And we've seen this not just in the district, but across the country. So a growing number of seniors that bring with them really complex health conditions. So it's the absolute portrait of who's most at risk for very severe complications if they were to contract COVID. So it's definitely been challenging.
Right. Mayor Bowser's really been active and really being a great city leader, ensuring that D.C. residents are aware of and then can avail themselves to the assistance that was found in the CARES Act that was passed. Can you tell us a little bit about how that program is working and what might be next?
Sure. Again, our agency partners have come together to stand up new programs, to expand existing homeless prevention programs, to streamline the administration. We've been doing work. I think we have 9 or 10 different prevention programs, which can be really difficult for people to navigate. So really thinking about how do people access those resources? How do we get the word out? But, people are in this just absolute limbo right now. We are still in the middle of the pandemic. And even though we have this moratorium on evictions, people don't know what the future holds, how long this is going to continue, when they might get back to work, when kids go back to school. So I think people face a really difficult decision of, do I apply now? Do I wait? We might be in this for several more months. I might need $5,000 now, but by the time this is done, it could be $10,000 or $15,000. So I think that's sort of what we're seeing right now, is sort of the slow uptake on resources, even though they're there. But then on our side, we are very concerned that we don't have enough resource. We can see that we don't relative to the need, especially if the federal government doesn't intervene.
Right. And speaking of programs, DC identified hotel and motel rooms that they could make available to populations that were vulnerable, exposed populations who were vulnerable to COVID-19. The Washington Post said on August 8th, it's always, there are a lot of difficult stories about this, but also these difficult stories talk about the difficult work that city leaders and others are doing to make sure that people are matched up with the resources available. And the Washington Post said, for the homeless, quote, the hotel program is seen as largely a success. Can you tell us a little bit about that specific program?
Sure. So we moved very quickly to set up 2 different types of programs in hotels. So I would say in our family system, we already have private room shelters, so we were really focused on our single adult population, which are in these large congregate settings. So we set up what we call our isolation and quarantine sites. So that's obviously for anyone who has contracted COVID or been exposed to someone who needs to isolate. So that's sort of one set of programming. And then our other set of programming is for those vulnerable, the most vulnerable. So seniors and people with really complex health conditions that put them at risk. So that's sort of more of a prevention track. We have 3 hotels, over 600 rooms now
600
for sort of that prevention strategy. And so, in the isolation programming, people, once they've been cleared by, and we have, case managers and supportive services, we bring meals in, we have actually doctors and medical staff on site to support in both of those environments. In the isolation sites, when people are cleared, they do go back to the shelter setting, but in what we're calling our PEPV, our Pandemic Emergency Program for vulnerable individuals, they are staying there until we can help them transition to housing. So that's typically who we would be targeting with our limited housing dollars is people in that profile. So they're moving straight into housing. Okay,
great. That hotel and motel program is partially funded by the CARES Act. So now that the CARES Act, that has already been passed and those funds have been distributed to states and local governments. State and local government relief has been a political football, if you will, knocked back and forth just down Pennsylvania Avenue in between Congress and the administration. Now, a stopgap spending bill was passed last week, and that doesn't have anywhere close to the dollars that are required and some of the dollars at scale that a leader like you would need to fund the programs based on the need out there. The HEROES Act, which was introduced by Chairwoman Maxine Waters from California, did have dollars at scale. This isn't a Democrat nor Republican issue, but it is something to say we need the dollars at scale to address these problems. What kind of conversations are you having with Capitol Hill? We saw a signal from Speaker Nancy Pelosi, I believe yesterday or today, saying we're going to restart the negotiations on it. So that's new information for this this discussion right here today. What else are you saying to Congress, and what are you hearing? Because it looked like they had adjourned without addressing this before the end of the Congress.
Yeah, that's right. I mean, those of us that are managing the crisis on the ground, unfortunately, don't really have time to be communicating with Congress, and that might be part of the problem. I'd also be remiss if I didn't mention that as a District of Columbia resident, I don't actually have representation in Congress. But if I did, I think what I would say is that we had a crisis before COVID, and it was maybe more of a hidden crisis and something that people weren't paying attention to. But we have clearly now reached the point of no return. And as an example, here in the district, we have 40,000 households roughly that are earning less than 30% of AMI, area median income. So that's about $36,000 for a household of 4. You can imagine how hard it would be to survive on that.
Right.
About 10% of that population at any given time will end up in the homeless services system. And so, there will be some shock to their household, job loss, a health crisis, partner violence, something that pushes them into homelessness. And so it's this revolving door, right? And so we absolutely need COVID. We need rent relief, emergency rent relief immediately to stave off this huge tsunami that's coming our way. We could, there are some estimates that we could see 30 to 40% increase in homelessness in the coming months when the moratorium is lifted. But we also need to, for once and for all, deal with this larger crisis. And so, my hope is that while I would never wish this circumstance on anyone, that people, the stress that people are feeling right now, my hope is that because so many more people now understand that there really isn't a safety net in place, and COVID has shined a much brighter spotlight on this problem, my hope is that our legislators will finally pay attention.
You've spent most of your career in this space, and before you became the leader of the Interagency Council, you were an advisor to, for example, the Department of Housing and Urban Development. Can you tell us a little bit about what HUD is working on, what's working, and what might deserve more funding, more focus?
Yeah, so I think, let me start by saying that I know that there are countless dedicated, really talented career civil servants that go to work every day to make sure that every American has a safe and stable place to call home. But I think under the leadership of this administration, they've not been given the tools that they need to do their job. And it seems like this administration has been more focused on rolling back protections for different populations, cutting assistance. And so I suspect that a lot of those really fantastic HUD staffs are put in the position of really having to play a lot of defense. And so I'd say on the ground, it's really felt like we're kind of in this alone, and that cities and states are just fighting this battle on our own. We know it works to end homelessness. It's a really simply elegant solution. It's housing. It's not rocket science, but we don't have the resources. And that's the biggest thing the federal government could do is just fund what we know works.
Right, that's kind of our slogan for mayors and CEOs for U.S. housing investment, that housing is an investment, not a cost. For too long in the United States, public funds for housing were considered a sunk cost, not an investment in small towns, medium-sized towns, big cities, and so on, but where you can bring in greater jobs, more population, and so on, and so forth. And that's something that needs to change. We're one of the few highly developed countries that don't consider housing infrastructure. That was something that Chairwoman Waters did include in the HEROES Act, and that's something that we're always advocating for. Unfortunately, we're certainly not alone. There are other great leaders advocating for housing as infrastructure. Kristy, you've spent most of your career in the space of homelessness and addressing the affordable housing issue in the United States. What are you most optimistic about right now, and maybe what are you applying most of your work to because you know it can get better?
Yeah, I think what I will say, sometimes it feels hard to be optimistic in the environment that we're in, but what I do feel optimistic about is that the solutions in front of us are clear. We know that housing works to end homelessness. We know that vouchers are a fantastic tool to get people housed and to keep people stably housed. And we know that has such lifelong implications for families in terms of their ability to pursue to stay healthy, to pursue employment, for their children to succeed in school. Housing is a platform for everything. And I think we've reached this tipping point where more people, including hopefully our legislators, are understanding that we really need to invest in housing. So I feel optimistic about the path ahead. I feel optimistic that for the first time, this is a conversation that I've seen in presidential debates. I hadn't seen that before. I feel optimistic that we have organizations like mayors and CEOs for housing investment that are helping raise this issue up. It's finally reaching this national dialogue. And so again, we know what the solution is. So if we can get the resources, and there really is no reason, it's not a matter of whether this country can afford it. We absolutely can. We're just choosing to prioritize other things. And so if the resources are there, we can absolutely solve this problem.
One more question. More people have been talking about the connection between housing and health and housing. Bureaucrats and so on, and elected officials have been speaking about this for a long time. And of course, people in the healthcare space, the public healthcare space, have been speaking about it for a long time. It seems like the volume has turned up a little bit because the private healthcare sector is now speaking more loudly about it, and others in other industries are speaking about it more loudly. Could you speak at all to the connection between housing and health? Do you see it? Do you hear it? Do you feel it?
Yeah, absolutely. I mean, I think this has actually been a mantra in our field for at least the last couple decades, kind of going back to the HIV/AIDS crisis. It became really clear at that point that housing was healthcare. And we continue to see that and say it. And I think, like you said, other industries are starting to realize that too. And as we've had more discussion about social determinants of health, and as health hospitals and MCOs and all the partners in that sector are looking for ways to get their costs under control, they see how much of an impact housing can have on people's health care, on their health. And so, it is so front and center in our conversation. And again, I think I mentioned that one of the things that keeps me up at night is that we know our single adult population is an aging one. And it would not be an exaggeration to say that sometimes when I walk into one of our shelters, it will feel like I'm walking into a nursing home. People get their health care through the emergency room. For some populations, it can be just a constant cycle in the ambulance back and forth. And housing does so much to stabilize people's health. There are some studies that suggest with this population in our shelter system right now, not just in the district but across the country, that healthcare costs will triple in the next decade if we do not get people stably into housing. And so again, it's the intersections are so clear to those of us in the field.
Unsustainable.
And I think that there's no better lesson or teacher than the current public health crisis, that housing is in fact healthcare.
Right. Just in closing, could you tell us about the fabulous facility where we are here in Washington, D.C.? We're just steps from the United States Capitol, as you can see in our video. Could you tell us a little bit about where we are?
Yeah, so we are in the John and Jill Kerr Conway residence. This is permanent supportive housing for veterans. And so it is, we cut the ribbon on this beautiful facility back in 2016. And it's really just a beautiful flagship property that I think has blends into the neighborhood beautifully. Like, people walk by and want to know what that beautiful housing is, or apartment building. And really it's housing for people that experience chronic homelessness in their lifetime. And not just anyone, but again, veterans, people that have served this country. So we're really proud of this beautiful building, and I hope you'll get a chance to take a look around.
We will. Yeah, no better example for the people who fought for this country over the years. Thank you, Kristy Greenwalt. We're very appreciative of your time today. Thank you, everyone, for watching.